I'm Dr. Joe Norris of McLean County Orthopedics in Bloomington. Rotator cuff tendon tears or rotator cuff tendon pathology is one of the most common reasons for a patient to present to an orthopedic surgeon's office. Rotator cuff tendon tears, or as some of my patients like to call it, the rotor cup, which does not actually exist, by the way, often present with simply pain. And there are really two broad categories of why someone will experience a rotator cuff tendon tear or pain from some pathology associated with your rotator cuff tendons. One is traumatic. Someone can fall and experience a traumatic, acute rotator cuff tendon tear, and afterwards, a patient may be even unable to lift their arm away from their body. This is obviously one of the more urgent or emergent reasons to be evaluated by an orthopedic provider. Another cause of rotator cuff tendon pathology, pain, or even a tear can be chronic. You can use your shoulder, as we all do, on a daily basis for a period of years, and the concept would be like a frayed rope, that the rope at times will fray a bit, until ultimately the rope snaps, and you have a rotator cuff tendon tear that leads to pain and disability. Often people present to me with a chronic rotator cuff tendon tear of pain for weeks or months, even years, but they finally came to me because they couldn't sleep on that shoulder. All of these complaints or presentations lead us to a specific evaluation and subsequent treatment plan. If a patient presents with shoulder pain with an acute traumatic rotator cuff tendon tear and they're unable to move their arm, we very quickly evaluate, often with an MRI, to rule out a traumatic, full-thickness rotator cuff tendon tear. This often will require more urgent treatment, although not emergent. If someone presents with chronic pain, and I suspect that a rotator cuff tendon or rotator cuff tendinitis could be the cause, we often will start with non-operative treatment. It could be an injection and physical therapy, or something even more simple than that. No matter what the cause or the treatment plan, it's important to know that you don't have to live with shoulder pain, and it may or may not be from your rotator cuff tendon. An orthopedic provider can give you the answers as to whether or not you have a rotator cuff tendon problem and provide you with the right path for treatment after a complete evaluation.